Hello, everyone. Good evening. And in between celebrations, I thought I'll make some 15 to 20 minutes or half an hour at the most to bring it to you a farewell for the 2025 to all my friends on all Noom Vibe, LinkedIn, YouTube, Facebook, and Clubhouse and Instagram, everywhere, right? This is Dr. Rao Kulsu. I'm a MD in United States, practiced for about 40 plus years, and then found something for the wellness. So all the illnesses that I treated prompted me that I should be working more on the other end where people can start to be well. 2025, our company, Be a Pal, which is an online wellness company, promotes wellness and really advocates wellness from the inception to all the way to the end of the life. So I'm very happy about it, and I'm very happy about the services we provide to the burning out doctors and entrepreneurs and stressed out IT professionals and company leaders looking for leadership training, especially servant leadership, and women entrepreneurs and people with obesity, people with menopause, people with chronic illnesses, mental illnesses, suicide, variety of them, right? We have the basically enhancing the human being from where they are to where they want to go, right? And I'm going to do a retreat on that too pretty soon. But today, let's farewell to 2025. I would consider a significant year for us because we have come up with the programs that are going to be very important and really helps people to um, live a better life and live well for a long time and also live well for a long time in a joyous way. So I want to farewell to 2025 with my most important thing that I understood for wellness, which is self-realization is the highest wellness and for the health. So this was the experiential truth for thousands of years. Many of the people who were really looking inward and finding their true self were having this quietness of mind, stability of the mind, and thereby stress is much less, and they were able to handle very tricky affairs of their life with uh, great wisdom of who they are. So, as we close this year and step into the next, we pause to remember something essential, that is, optimal excellence in health and wellness begins within. The journey to healing is not only external, it's a profound return to the inward self, inward conscious being, right? Self realization, the deep understanding of one's true nature beyond symptoms and diagnosis, results in the highest health and wellness. See, modern medicine is powerful. I was trained in that. It is precise and life saving, especially in acute cases and injuries and needing surgery, vaccines, and all that. And yet, it's incomplete without a dimension of the inner wholeness. So, this presentation I'm going to offer you today is a bridge between the two worlds that belong together. And I belong to both worlds. I kind of feel incomplete if I'm only confined to one particular aspect of healthcare. And as much as we have scientifically advanced, we have so many wonderful breakthroughs, and I have been following them and applying them as much as I could. Um, but also, I'm not blind to the problems of the acute medicine, acute scientific medicine, and all that. That's something that we all know that. Okay, and we don't have to go and get some things that are not really proven, or but some of the ways of ancient wisdom about the mind and mind management, emotional intelligence, and also our responsibility to the planet. They're well versed in that. Okay, in that way, I'm very happy that I was able to look at these things. Okay, so what modern medicine does brilliantly is something that we need to um, recall. So before exploring what may be missing, we honor what modern medicine accomplishes with extraordinary skill. See, contemporary healthcare has transformed human survival, right? uh, the average age has going up and flourishing in ways our ancestors could scarcely imagine. We diagnose disease with a remarkable precision using imaging, lab analysis, and genomic sequencing. And we treat emergencies and infections with a life-saving speed and effectiveness. That is true. And manages chronic illness through evidence-based protocols and continuous innovation. But still, we are having too much of chronic illness. I will come to that later. And also, modern medicine extends lifespan significantly, though often without restoring the experience of inner peace and wellness and all that, right? So, this final point invites our inquiry. We can prolong life and sometimes miss the deeper experience of being truly well, right? Very confused or agitated minds, very much dependent on so many addictions and so much of mental illness, relationship breakdown, and generally not having firmness in the body and presence in the mind and the quietness in the mind. That's missing, right? So we're going to see that. Okay, as we really pay attention to the modern medicine and its problems, we will come to know why this is so. Okay, see, it's like a silent crisis. Health, yeah, but without wholeness. Health also is not accessible, good health care for everybody. But then, even if it's available, that doesn't have the wholeness. Right? People are worried well and having these chronic disabilities because of chronic disease, and they survive. They go along, but don't have the pep, don't have the wholeness, right? So we see the stress disorders are increasing, and we have lifestyle disease patterns, which I talk about all the time, and epidemic of disconnection and or loss of personhood. So let's look at a little deeper into that. Beneath the surface of medical progress, a quieter crisis is unfolding. This is not a failure of medicine itself, but rather a systems level gap. The unintended consequence of speed, fragmentation, and reductionism that weakens the inner dimension of care, right? The stress disorders are rising, burnout, anxiety, and stress related conditions are climbing, even among those with access to excellent care. There are a lot of people have the access to excellent care, but even then they suffer with smoking, alcohol, drug addiction, or so many other things. And then the lifestyle disease pattern. This is the civilizational disorders I call about, and chronic conditions driven by dysregulated attention and fragmented habits and loss of inner stability, right? Burnout, anxiety, and all that. And also diet related, diabetes, cholesterol, and all that. And then there is an epidemic of disconnection, loneliness, worried well, anxious, always worried about the life, and depression or negative about the life. that is persisting even amid material abundance, comfort, and also medical intervention. So it's like people are not connected to themselves and to the world in the right way, in an excited way. Okay, and loss of personhood. So patient they increasingly feel treated as problems to solve rather than persons to know and accompany. Right. So that personhood, personal care is missing too in the modern medical care because that's mostly connected with all sorts of remuneration, revenue based institutions, right? So they uh, care more about that, not really what is important for the patient. Okay, so that brilliant modern medicine reviewed that shows that we are progressing in so many fronts, but not all is evident for the people, right? For everybody, but in the ancient traditions, what they did was all the medical care was provided free, and most of the uh, gurus or so-called healers, they provided service at the free of cost. Okay, so that kind of fascinated me. I understood why that was so because they valued healthcare as a basic fundamental right, and we are supposed to give it to everybody if we have the knowledge about it, if we have understanding about it, if we have the means to do that. And then they defined health not just how we are appearing, how we are eating, how we are exercising, that's all part of it, but they have this health as inner harmony, harmony with oneself, harmony with the family, harmony with the society, harmony with the nature, harmony with the world, right? Thousands of years, healing traditions across cultures, not one particular culture. China, India, Egypt, or South America, Africa, America, any of them, they measured well being not merely by the absence of disease, but with the quality of consciousness itself. This ancient lens offers medicine a missing dimension. Health was understood as a stable mind, an aligned life force, life force, a compassionate heart, and a clear sense of meaning and inner sufficiency. You're good feeling as a human being. Wellness was an inner state that radiated outward into our behavior, our relationships, and our resilience. This definition does not replace modern diagnostics, it completes them. We can use all the, like I'm using stethoscope, I'm using all the lab data and everything, but also I look at the person as a whole. So, this definition asks us to measure not only what is broken, anatomy, physiology, which we do, and then what remains whole within each person. That is what we want to pay attention to: the energy, the vitality, the feeling of optimism in life, that kind of thing. Okay. So, as we are looking at this silent crisis, which I said, health without wholeness, keep in mind what the definition of the ancient was. Okay. And as you really understand, there are certain patterns that emerge that anybody can follow these days, right? So we were going to look into that, okay? Especially the healthcare workers who are working with people, who are healers, who are working with people. They want to really understand this definition. And the highest for that is we recognize who we are. See, the core thesis I'm going to explain to you now is the self realization, the highest wellness status. So, self realization is not an abstract spiritual concept, it's a shift in identity with profound clinical implications. It means knowing oneself as awareness itself, not merely as the body mind complex that experiences symptoms. Okay? What it does is it reduces fear and reactivity. When identity expands beyond symptoms, chronic stress, chronic stress load decreases measurably. Okay, because now you have no fear and reactivity, and then stabilizes your behavior because you have an inner clarity that creates sustainable change, not through willpower alone, but through alignment, and then transforms health paradigm. Wellness shifts from endless management to a state of inner mastery and resilience. This is not a cure for disease, it's a foundation that makes every intervention more effective, every setback more bearable, and every recovery more complete. So, very important from the viewpoint of a physician or a somebody who is helping people to live wellness life for a long time and in a joyous condition. So, this is why this is not just understanding, but then realizing, which is already there, is important. Just understanding is no big deal, but really understanding it and then implementing is the big deal. Then everybody will experience their own um, you know wellness, their own vitality, their own energy, their own approach to their response to the illness that you should happen. Naturally it will happen, but you have the resilience to first of all handle the illness better and not succumb to it, but more like developing a resistant pattern. So I'm going to translate it in a clinician friendly transition. See, we as healthcare professionals trained in evidence and mechanism. Okay, so self-realization can be understood through frameworks already familiar to behavior medicine and neuroscience. You don't need to adopt new beliefs. You don't have to switch your religion, none of it. Only observe what changes when attention itself is trained. So, number one, attention training. See, it reduces rumination and catastrophizing. That means you imagine some catastrophe to your illness. So, what it does is it improves executive function and self regulation capacity. That is what happens with you training attention turning inward. Okay? Not self absorption, but mind's attention turned inward. Okay? Now, inner safety. It shifts the autonomic focus toward parasympathetic dominance. That accelerates your recovery and stress. Normally, what is happening is autonomic tone is increased because we have the fear and concern about things, right? That's not there, and you are resting and digesting better, and you are really increasing the parasympathetic dominance in autonomic tone. That accelerates your recovery. It helps you to recover faster and stress. You have more resilience for the stress. That's the main thing. Okay. And then you have meaning and connection. It strengthens your resilience under illness. You have illness, but then this meaning and connection helps you not to let your mind go all over, right? So improves more like you want to adhere and cope through sense of purpose. You as a human being have a purpose, have a meaning that dominates and then helps you to have the resilience to deal with challenges in life. And finally, you are the witness of what's going on in your body and mind. So that witness consciousness reduce pain amplification, that is reduced, and also emotional reactivity reduced. So by creating some distance from your psychological uh, way you feel about symptoms. Okay, these are not speculative effects, they are observable, measurable shifts that complement every other intervention in your clinical toolkit. Training the attention, developing inner safety, developing meaning, connection, and purpose, and that being witness of those states that are going on within you gives you real good uh, way of distance from the symptoms and cope with them. Not just cope with them or bear them, but have the ability to overcome them. Okay, that is a clinician friendly translation. How so a patient comes, you just say, oh, what is your problem with you? But you also see how he is reacting emotionally, how he is has a purpose and meaning, and really in his life he has some connection with his inner self. That's what we are looking for. Okay, so that goes into uh, my analysis, my understanding of my pain suffering of my patient, whoever comes with whatever symptoms and all. So some people, they go down very much because they are weak inside, but some people are really have this philosophical, they, you know, happy-go-lucky people. Okay, they are kind of that, but this is beyond that. This is really understand as a human being. I am that inner energy. I'm the self that we call it as a big S self, and then realizing that energy is me is the self realization. So it's not a spiritual abstract concept, it's a shift in identity with profound clinical implications. So, shift in identity is what we're talking about here. Okay, as you look at this, then you will say, okay, health as inner harmony, and then there's a uh, integration of body, breath, brain, being. These four B's you remember. This is the proactive wellness integration. This is how I came up with the proactive wellness. Is not about just treating the illness, but being the proactive by taking care of the body and breath for the energy, and then brain to calm it down, and also really establishing ourselves in our inner being, where that really makes our stress hormones go down completely and keep us very well. So, when proactive wellness offers a comprehensive framework, what it does is it bridges conventional medicine with inner development too. The inner development is mostly from the ancient wisdom. They paid attention to it, they worked with it, and they worked not just a few hundred years, but thousands of years. So we have lot of experienced, validated systems that are going among the ancient cultures very much so. Some of it has gone into disreputation because people who know it, they don't know everything truthfully. You have to go deep and study that. Okay, so take your body. They have this body mind awareness movement. You just don't move, but you're also aware of what is happening with the movement with your body, and you are aware of what you are putting in your body, nutrition, air, and the water, and also how you are resting and sleeping, how you are uh, recycling your energy. See, these are essential physiological foundations that you want to build. You want to eat well, you want to breathe well, and you want to move well. The breath is very important because it does the autonomic reset, and it does the energy regulation, and it has the nervous system coherence, right? So you can try it by yourself. Suppose you're thinking pretty fast, stop and take deep breaths and see how your thinking goes down without any medication. Okay, for the body, your physiological foundation of nutrition, movement, and sleep. For the breath, it's a reset, energy management, and nervous system coherence. Then the brain itself. How do you think? Thought hygiene. What are your emotions? How are they regulated? And also, what is your cognitive reframing? How do you go from negative to positive thinking? Like that. Okay. And finally, your inner being, your life itself, and find out who am I? Self inquiry. And find out that all can be silent, inner stillness, and it can be aware. So, awareness of your thoughts, your emotions, your physical symptoms, everything is comes because you are aware. So, awareness is before thought. You are aware of your thoughts, right? Then you know. So, this is the missing tile that stabilizes all of this, the being. It stabilizes the body, breath, and brain. When all four dimensions are engaged, health becomes sustainable, resilient, and intrinsically rewarding. Not a perpetual struggle against decline, but it's more like a intrinsically rewarding. When it is intrinsically rewarded, you automatically go into that more often. Okay, but if it punishes you, then you won't, right? So that's why you want to understand what this proactive wellness integration of four B's. Okay, body, breath, brain, and being. Okay, that being is something very much new to a lot of people. But when I kind of look at it, it is the fundamental. That's the difference between ancient wisdom and the modern scientific understanding, because they don't pay attention to the consciousness. They don't pay attention to the inner being. But everybody feels that I'm not just the body and mind. I have this inner understanding, inner impulse that comes through. That's why I have the body and mind. They're kind of our good instruments, but they are not us. And we make the mistake of identifying with them, right? So a live practice, is a 3-minute clinical practice is poising on the self. You are poised, not your feeling of I have the body, I have the mind. They have them, but you are not them. But you can be on poised on the self itself. So this is not theory. It is something you can experience right now. See, what I'm going to give the practice can be offered to patients under 3 minutes or used by clinicians to reset between appointments for themselves. It requires no belief system, only willingness to observe. Number one is ground the body. Sit upright, soften the face, exhale slowly through the nose. Second, witness your thoughts. Notice thoughts as events passing through awareness, not commands to obey. So don't get into the thoughts, just observe them as the objects. Then ask inwardly, who is aware of this experience? What is noticing these thoughts? So you're grounding the body, number one, witnessing the thoughts, number two, and then ask who is observing these thoughts. And then you realize that your awareness is aware of these thoughts. Rest as that awareness. Simply be the noticing presence for 60 to 90 seconds without effort. That's the main thing, right? And then you can return with clarity. From this stillness house, what is one kind, clear next step? Right now, pause for 30 seconds. Notice what shifts. This is experiential self observation, not religion or belief. If you believe, then you are acting from that, not what is available right now. So, if you are religious and all that, that's all fine, but that's not what I'm talking about. I'm talking about simple experiential self observation of your thoughts. Try that, and for 30 seconds, and you will notice that shift, what shifts. And this is the experiential self observation that really helps you to be in that stillness of mind, and that becomes the moment to moment awareness, and then you go from there. Okay, so this is a simple thing that anybody can observe and also really be that. Okay, so as you go into the practice more and more, and as you go to practice, as you live your life, then you will understand how that peace and quiet and all that is there, because you have realized you are not just the body. You have the body. You are not just the thoughts and emotions. You have them, but who is aware of them? That awareness is you. That is the realization that you are the self. Self is a big S. That is the energy. That is the consciousness. Okay. Once you are standard in that, then you are not a victim of thoughts going all over, and then providing fear or concern, and then stress hormones and all that. And they're also able to really understand what is happening with me. See, where this helps immediately is self-realization practices. They are supportive and they are adjunctive. They complement medical treatment, improve your coping capacity, and strengthen the patient clinician relationship. Because patients are like us because we kind of understand their suffering, we sympathize, but also we know that, and we are showing right there. We're not like a uninvolved people just giving you some medical treatment, chemicals, but we are also human beings relating to your suffering and understanding. It's not just sympathetic, really knowing the suffering, the pain, the suffering that people go through. So there are some conditions I'm going to list here where inner awareness work basically delivers measurable benefit without adding cost or complexity. Number one is chronic stress and insomnia. So as you are not reacting, as you are really, observing the reaction, they subside. Is that sympathetic overdrive, which is the culture all the time? Because from morning till evening, people work with fear, people work with concern, people really stimulate their sympathetic nervous system, fight or flight syndrome, and that is really overdrive by the modern life. And the people will be nurturing on the dangers that they have perceived in their mind. They may be there, they may not be there, but they will be in the sympathetic overdrive that goes down. Okay, and then this anxiety burnout, they create a this self-realization creates a inner stability that reduces reactivity and also emotional exhaustion. That is what is I see all the time in the burnout people. Okay, and then your pain with the central sensitization decreases because it stops catastrophizing your pain and amplifying your pain through just being aware of it. You are going to a place where you are not occupied by the pain, but you are withdrawing from that, observing it. This is very important to understand. Okay, and then you have the lifestyles are changed, and then you find that things are much more easy in your food selection, activity, and addiction patterns. Then so you will be adhering to those lifestyle changes much better, and you realize that you are not just the body and mind, you are the inner self. Then end of life distress, you will not have that because you know the existential fear is gone, and then restoring your dignity in final transitions. You accept everybody who is uh, born will have to die too, but you can have that without fear. And then clinician resilience is a say you don't feel like you're a clinician, you are not delivering what is morally important, and also you are really uh, protecting against the moral injury, and also compassion fatigue. So clinicians become more resilient as they provide care and wellness measures for the patient. That is something I have to put in there because as a clinician I experience this quite well, right? And as we understand this, as we go to the practice every day, really being in that inner witness energy, then you will see you are operating on the problems of the body and mind much better. Okay, and then you will be benefiting the good effects of this being away from the identification of the body and mind, and you will be able to stand apart and look at them and work on them. Okay, so that's where people have to understand. So my for the 2026 is wellness as wholeness. Say as we enter the new year, we want to offer a commitment, not a dogma, but an invitation to experiment. What if, what if what if health systems could do both? Treat disease with science and restore the humanity or human being in the human with awareness. Treat disease with science. Yeah. Honor every tool modern medicine has earned through rigor and evidence. No problem. And then let health become a lived state. not a lifelong chase, but a present moment experience of inner sufficiency. You feel energetic, vital, and has a real good vitality and sufficiency inward. You feel that, and you feel that you are joyful, you are happy with no cause, and then you will be participating in life in much more vitally, right? And then you are restoring the humans with awareness. Invite each person back to their inner ground of being that remains the whole. And then self realization is available to all. See, the highest wellness accessible without cost, belief, or external permission because you have shifted your identity from being just the body and the mind. Body is yours, mind is yours, but you are not just them. You have something more important of the what's called we call self or witness consciousness or being or energy, whatever we call it, life force. All these things are put into the big S self. Right? So universal consciousness is there to all of us as awareness, and we kind of live apart from it, thinking that we are the thoughts, we live in the thought, or we live in the body because the symptoms are identified and we suffer. Okay, so this won't happen just like that. You got to give it enough attention in life's events every day. Most of the time, people are caught in their mind, in their thoughts, in their identity with the personality or ego that they have developed with the thoughts. That's a big problem with the modern mind. So they suffer. You don't have to blame them, but you identify them, you understand them, and gently show them how to shift from this limited identification of the body and mind to our real inner self. Okay. So I just made an attempt to just give you a glimpse of how I operate, how I take these things into my account, and how I really live moment to moment awareness. Then I can use learned lessons from the past, but when they're applied, they are here and now, present. I can plan for the future, but when I'm going towards that, whatever I wanted to do, I focus on the process here and now. Then each day is like a beautiful day, and each day kind of gives me a lot of energy, lot of not wasting it on fearful impulses or um, mm, anxiety and worries, none of that. Okay, so let's say, uh, Peter, you want to come up and see what do you think about this? uh, Anybody, you want to come up? I know this is a night, everybody's busy partying, busy, so I found some time because I have the gap between the goodies that we're going to have and the celebration starts around 8 o'clock or so. So I thought I will come and talk to you guys and also really establish a seed in whoever listened to me and then not necessarily agree with me, but follow with me, but then understand they have the seed of realize the self within them. And once you identify, once you recognize that, and also see if you are making the mistake of identifying with your body or with your thoughts, which come and go, which change anyway. And there's a huge difference in your energy, in the way you handle your physical illness, in the way you handle your negative thinking, in the way you handle relationship with other people. If you identify people as beings, which is actually they are, then in that being level, we are all in the same level. We are all actually same. We don't have any religion there. We don't have any gender there. We don't have any, all these philosophies and all that. We have that energy in all of us. And once you are established in that by realizing that it is already there, then thinking will be much easier to handle. And you can also enjoy the non thinking state of awareness where your mind is still. That itself is like a blessing, right? And once you experience that, it's like going under the shade of a tree because you are walking in the burning sun and you feel cool, kind, and you taste that and you want to come back to it, and you stay there as long as you can, right? So, this is something like not escaping from the challenges or stresses of life, but developing that resilience within us so that we can handle life's challenges and presentations and testings, everything that comes our way, not with weakness, but with strength of self reliance, okay, inner resilience. That's what I am about as a physician. I see patients with physical problems, mental problems, relationship problems, confusion, and so many ways they can't handle their senses, they can't handle their mind, they can't handle their impulses, and all that. And they also has the arrogance that we are exceptional. No, you don't become exceptional just because you are educated with your mind. That's actually liability. You become exceptional because you tapped into your inner being. That's not your thought made. It is there to begin with. Okay. So once you understand, you become more heartful, more kind and compassionate to the people who are suffering. And you don't look down on them because they are you. We are all in one energy. It's not just a word, it's a real fact. And once you get that, then it will be so much easier to relate to people who are suffering, who come to you for relief. And then really, it's a privilege to be able to direct them towards that relief from the suffering, either completely or measurably, maybe little or more. Okay. So that's what I was trying to tell you on the eve of the new year. And it's more like it's a closing O for me as we start 2026 and end the 2025. Wellness as wholeness. So, this commitment I'm offering, not as a dogma, but an invitation to experiment. What if health system could do both? Treat the disease with science and restore the human with awareness. When you are aware of your own thoughts, see what happens. You can treat the disease with science, which we do. We want to use all the tools that we have discovered in the modern medicine. Even them, people are not aware. Ask yourself, did you have your chemistry known? Did you have your genomic pattern known? Did you have your tendencies for probable illness because your body and mind is warning you? Have you put up with them or took action? That's very important, right? And then you restore the human with their awareness. Awareness includes thoughts. If you are not aware, you are not aware of your thoughts. You are aware of your thoughts, right? That thoughts are happening, thoughts are coming, this is negative, this is positive, all that. So awareness is always ahead of your thought. The modern man anywhere on the world making the mistake thinking thought as the fundamentally first and last. That's a mistake. And also, how vital are you? How energetic are you? How complete are you? How much you have the present moment experience completely? Or are you living in your thought and the mind? Say, health becomes a lived state. That means every day you are healthy. Okay? It's not a chase, but a present moment experience of inner sufficiency. And then self realization is available to all. We can realize who we are just by taking the deep breath, asking the question, what are these thoughts? Where are they coming from? And then staying in that energy. That is realizing ourselves. Okay? Oh, Peter is coming up finally. I didn't mean to pull you all from your partying, but I thought this is important to say. You can always listen later. Hi, Peter.
pajama party. I literally just got into my PJs for the
night. Okay.
So I'm having a pajama party. I just walk the dog. I listen to you the whole time.
Yeah.
And yeah, so yeah, it would be great. I think some of the components exist in our healthcare system to get partly there, right? But I don't know that they're connecting and interfacing like they should.
Yeah.
But greater than any AI could advance humanity would be just if people can just realize.
No, from my experience as a physician, Peter, what I discovered was healthcare is not complete unless I brought in the wisdom from the ancients.
Yeah.
Not the weaknesses, not the divisions, not the identification with the religious thing. No, not that. That's not the belief system. I want to understand what worked, what is the wisdom that we got it up. Like, for example, unpolluted water, right? That's a life truth. So what I am doing as a physician, why this is so meaningful to me is I found so much illness, even still it is continuing. Many people are not aware that they are breeding all these illness factors in their diet, in their activities and all that, right? People are not even sleeping well, even though that is the one which restores you back. So what I said was, hey, this outward complexity is not for us. Let's be simple. But inward, we are human beings. We have this faculty of awareness. Let's not get lost in this neurotic behavior of continuous thought, but use the thought as a good tool for us.
Right.
I succeeded in that. That's why I'm not in the thought of yesterday or tomorrow, but I'm in the present moment mostly. And I want the same experience to all my friends. That's all.
Yeah.
And then they have to do it themselves. They will do it.
Yeah. Yeah. I mean, I tasted it. I need it in that too. And as you know, I'm learning more and more to stay in it. And I did a good job today. I really did.
Very good.
So and talking to you always helps me. Hearing you is always a good reminder, Dr. Rao.
Yeah.
And for me, what a great way to end this year and go into
my even 1% does that, my life is accomplished.
Thank you.
See, but it's for everybody. The compassion comes for every heart, every human being, and also so much of suffering that we are going through is unnecessary.
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 We don't even know it.
Yeah, that's the problem. That's a tragedy because we are modern, intelligent human beings, but we are kind of drugging ourselves with all sorts of false beliefs or kind of escapism, kind of not really taking energy to put into getting well, those kind of things. They are simple things, but people are realizing as I talk to them, I mean, other people to send me messages where they are beginning to look at, yeah, why do I have to eat the same food that's going to produce me all these problems of diabetes, hyperlipidemia, and all that? And they're changing it. Not just because, oh, I want to not to have the illness, fear, but more like, I don't need to have this. And invite
that's
this.
A wellness mindset. I love that. That's a wellness mindset.
That's it. That's it. Well, that's our mission, right? It is not illness-oriented system we go to by living all illness-producing lifestyles, but we're cultivating a wellness mindset not only in us but also in the health systems.
That's where it needs to be.
Yeah.
So, that's where it really needs to be.
Look at even money-wise, $1 out of $5 we're spending for the health, and also we're suffering.
It's crazy, and it's not working.
Not working. That's exactly what it is. People may be forgetting how their bodies or minds are going through when they're working. They're so busy. But then it gets to them in the middle age, and then they live in chronic diseases, complications. You don't need to. That's my point. My life is a demonstration of that. 71, no medications, performing at the highest energy.
That's beautiful. Yeah. That's beautiful.
It can be done. That's all. I'm not saying I'm superhuman or anything. No, I just realized to be a human being. That kind of thing is there within us, and that is really superpower, Peter. Once you have that superpower, you got to rest in that. You got to stay in that. And influencers by other things are so much, people are not able to stay in that energy, stay in that know-how, stay in that realization that we are more than just this inert body, more than just this passing thoughts, more than identifying I'm so and so, made by my own ego, my own personality, my own thoughts. Beyond that, I'm aware of all these things going on. Stay there, what who you are. That has become very difficult because of the information flow is so much. And so many people don't realize they themselves developed this ingrained impression about themselves and then accept it without really going into it and say, where is the thought coming from? Why am I having these thoughts? Why do I have to identify myself and so to live life as it is now? Most people don't live life in the present moment, don't live in life itself. They live in their mind, in their thoughts, in their past memories, in their future aspirations or whatever hopes they have. But that's not real. What is real is this moment, right? It's more like a not trying to influence people, but bringing them back to their own reality. You don't have to accept anybody, anything, or to have to become certain kind of religious practice or, you know, the faiths or anything like that. Be just normal in this moment, here and now. Look at where these thoughts are coming from. Who is that is having this thought? Then you will come to your awareness. To be in that awareness, you don't need to become any particular community or any particular country or any particular identification, right? Hopefully, that makes sense to you. And I will see you again tomorrow morning. Uh, I will do a special uh, morning routine, and so that you can carry that throughout the year. Okay, and then we will talk about what is materialistic orientation versus what is this inner self-realization orientation. In yoga terms, it is called bhoga versus yoga. When you are indulged in the comforts of the materialistic life, which is not a crime, but you will not be able to realize who you are. You will not be able to develop this inner resilience and all that. That's why they developed a detachment to the external worldly affairs all over from the ancient times towards this inner resilience, inner realization, inner capacity to be sufficient, right? And then outward life was much better. So we're going to look at that with a lecture at 9 o'clock. I'll be doing that. Okay. Uh, I will do the I will do the uh, Zoom session, and but also all the other platforms will carry that. And hopefully, people, it's an advancement to what I was talking about. Why modern systems are indulging in so much and then leading to addiction of so many varieties, thought addiction, drug addiction, alcohol, smoking, any number of things, right? And versus what is it as a human being developing this intelligence to turn inward and develop, see that these things that are addicted to or attached to are not permanent, and let them go. Don't cling to them. And then really pay attention to our own inner intelligence and identify that energy which is giving us life. Okay, that's what we're going to talk about tomorrow. Thank you. I will see you again tomorrow morning. Bye bye.